Auschwitz-Birkenau stands as the ultimate testament to industrialized death. We often focus on the gas chambers, the forced labor, and the selections, but within this system of erasure lay a hidden, almost unimaginable tragedy: the fate of pregnant women and their newborns. In a place designed to extinguish humanity, pregnancy became a crime punishable by death. Here, motherhood was systematically inverted, and medicine transformed from a healing science into a brutal weapon of destruction. This is the story of how the Nazi regime sought to erase, generations before they ever drew breath, the illusion of mercy. By 1943, facing increasing international scrutiny and seeking to manage labor more efficiently, the SS authorized the creation of a facility that seemed, on the surface, to be a concession, a so-called Schwanga block. This was intended as a maternity barrack inside the women's camp at Auschwitz-Birkenau. To any outside observer, this establishment might have been interpreted as a rare gesture of mercy, but the grim reality was that the barracks, specifically Block 24, later renamed Block C in Sector B, became a hidden theater of suffering. It was a place where life began, only to wither almost instantly. Pregnant women and newborns were confined to this block, yet conditions were scarcely different from the rest of the camp. Imagine overcrowded wooden bunks stacked 3 high, zero heating during the freezing winter months, no clean water, and disease spreading uncontrollably with every breath. Crucially, despite being labeled a maternity block, there was a deliberate absence of basic care. There were no medical supplies, no sterilized instruments, and no professional midwifery. Mothers were forced to give birth lying on filthy straw, assisted only by fellow prisoners who, despite lacking training, risked severe punishment to provide assistance. For non-Jewish prisoners, particularly Polish political detainees, there was sometimes a different outcome. Their babies were occasionally spared, but even for these few, survival was unlikely. Many of these children were ruthlessly taken from their mothers and sent to the Lebensborn program, or subjected to racial evaluation by Nazi doctors. If the infants failed to meet the stringent, so-called Aryan standards, they were discarded, with some literally starving to death in isolation. However, for Jewish women, Roma women, and other targeted groups, the policy was one of unrelenting extermination. The barrack for mothers was never a place of safety. It was merely a fragile illusion of mercy masking this deadly policy. Women gave birth knowing, fundamentally, that their babies would not survive, and yet, in that abyss of certainty, they hoped desperately, courageously, defiantly. This tragic hope embodies one of Auschwitz's most profound tragedies, that even in a place designed to erase humanity, some dared to hold on to it. Medicine inverted their experiments. In the very heart of Auschwitz, the science of medicine was brutally inverted. It was transformed from a healing practice into a weapon of destruction. And for pregnant women, this perversion reached its most monstrous form. This was achieved through the so-called medical experiments, overseen by SS doctors such as Joseph Mengele, Karl Klauberg, and Horst Schumann. These procedures were not experiments in any scientific sense. They were calculated acts of mutilation carried out under the guise of legitimate research. Joseph Mengele, notorious among prisoners as the Angel of Death, held a particular obsession with twins. However, he also subjected pregnant women to brutal procedures. Survivor testimonies describe how women, once identified as pregnant, were deliberately selected for experimentation. In many cases, these women were operated on without anesthesia. Abortions were forcibly performed purely to observe the effects, and the resultant fetuses were collected specifically for anatomical study. One survivor recalled that after a group of women were examined, they simply never returned. Their names vanished into the silence of the crematoria. Perhaps one of the most horrifying figures involved in these medical crimes was Karl Klauberg, a gynecologist. Klauberg was tasked with developing efficient mass sterilization techniques. He focused primarily on Jewish and Roma women, many of whom were pregnant. His method involved injecting caustic chemicals such as formaldehyde or silver nitrate directly into their uteruses. These chemical injections caused unbearable pain, severe infection, and often resulted in the victim's death. Clauberg's objective was chillingly simple: to determine how efficiently a woman could be sterilized without the need for surgery. This goal aligned perfectly with the Nazi regime's broader vision of ethnic cleansing. Meanwhile, Horst Schumann carried out X-ray sterilizations. He aimed X-rays at women's abdomens and ovaries. This procedure caused severe burns, inflicted devastating internal damage, and frequently resulted in lifelong infertility. Pregnant women subjected to these exposures, if they were not killed outright, often miscarried or were permanently left sterile. These atrocities were not merely rogue actions carried out by isolated doctors. They were sanctioned and actively encouraged by the Nazi hierarchy. The regime sought aggressively to reduce the birth rate of those groups it deemed racially inferior. What remains deeply disturbing is the illusion of science maintained throughout. Records were meticulously kept, and observations were noted. Yet, the women, many of whom were educated, some even nurses themselves, were viewed not as patients deserving of care, but as specimens. There was no ethics, no consent, and absolutely no humanity. These were methodical, institutionalized violations. Expectant mothers, already profoundly weakened by forced labor, disease, and starvation, became the unwilling subjects of some of the most egregious crimes in medical history. And still, some of them fought desperately to survive, not for themselves, but for the unborn lives within them. This was a resistance not of weapons or rebellion, but of sheer, unyielding will. Infants born in hell. The fate of camp-born babies was sealed the moment they drew breath. Auschwitz was a place where the very act of birth became a death sentence for the few women who managed to carry a pregnancy to term. Amidst the starvation and labor, the arrival of their child was not met with joy. It marked the beginning of another unspeakable ordeal. Infants born in Auschwitz were condemned by their mere existence. Under the twisted logic of Nazi ideology, babies born to Jewish women, Roma women, or other targeted groups were automatically considered subhuman. Their deaths were rarely accidental. They were policy. Before 1943, the policy was immediate and absolute. Nearly all babies born in the camp were murdered instantly after birth, even with the introduction of the Schwanga block, which existed only in name and not in function. Infants were killed by various brutal methods: lethal injection, drowning, or simply left to die of exposure. There was no pretense of care, no medical attention, no acknowledgement that life had been created. The horrors faced by women in the medical blocks are brought into sharp focus by the testimony of Dr. Gisela Perl. Dr. Perl, a Hungarian Jewish gynecologist imprisoned in Auschwitz, later recalled the unimaginable choice she was forced to make. She was ordered to perform secret abortions in the barracks. She did this to spare women from execution and, perhaps more mercifully, to spare the infants from a certain and agonizing death. As she later wrote, "I was ordered to destroy life to prevent life, to prevent the birth of Jewish children. It was the greatest torture of all." By late 1943, camp policies shifted slightly, particularly in the so-called Gypsy family camp Ziegler, and later in the main women's camp at Auschwitz-Birkenau. A small number of births were temporarily tolerated. Some infants were allowed to live, but often only so they could be subjected to experimentation or forced labor, provided they survived long enough. For most, however, they were simply left to die slowly. They succumbed to untreated disease, starvation, or exposure to the freezing temperatures. Auschwitz provided no formula, no diapers, and no medical care. Mothers were often too weak from hunger and labor, even to breastfeed. Lice and infection were rampant in Block 24. In this so-called maternity ward, Up to 90% of newborns reportedly died within days. Those few who survived a few weeks became living corpses, emaciated, motionless, and silent due to their prolonged suffering. Only a handful of babies are known to have survived Auschwitz. Their existence depended on extreme luck, external intervention, or transfers late in the war. Their survival is a haunting testament to the resilience of life amid engineered death. But for the vast majority, being born in Auschwitz meant entering a world built exclusively to erase you before you ever had a name. Conclusion: Auschwitz was far more than a death camp. It was the intended erasure of generations. The fate of pregnant women and their newborns stands as one of the most haunting testaments to how profoundly ideology can corrupt motherhood, morality, and medicine itself. These atrocities were not the random acts of a few twisted minds, but the deliberate output of a system designed specifically to extinguish life at its most innocent stage. This systematic violation of the most vulnerable is an essential part of the historical record, a reminder that the Nazi regime aimed to destroy not just individuals, but the entire future of the people they targeted. How should the world remember a place where being born was defined as a crime, punishable by death? We ask you to comment below. Share your thoughts on how we must ensure this chapter is never forgotten. Like, subscribe, and join the blood and iron community as we continue to shine a light on history's darkest moments.